already.
Okay. So you may call, when you call the meeting to order, and then I'll go with the roll.
Okay, so the meeting is now called to order, and according to the computer time on the monitor, it's like 2:01 p.m.
Yes, thank you. I'll do the roll call. Commissioner Chung,
Here.
Commissioner Guillermo,
Present.
and Commissioner Chow.
Present.
Great. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Item 2 is the approval of the March 7th, it should say 2023, and I apologize for that, committee minutes.
I would move approval, but I would ask that on number 7, I believe that it's Commissioner Chung as our chairman who actually thanked Mr. Chase for his presentation.
I'm sorry, could you repeat that, item 7, and then what did you say?
Right. That it was Commissioner Chung who actually thanked Mr. Chase.
Oh, okay.
Because there were no comments, and Commissioner Chung is our chairman.
I'll make that correction.
Thank you.
I'll second.
Okay, so all in favor, please say aye.
Aye.
Okay, and we have adopted the minutes.
Great, thank you. Item 3 is the monthly contracts report.
Good afternoon, Commissioners. This monthly Health Commission report contains 10 items. I need my glasses. The first item is for Vicente Consulting. The requested action is the approval of a contract amendment with Vicente Consulting to increase the total contract amount with contingency to an amount of $3,430,326, an increase of $1,689,077, and to extend the term by 1.5 years from January 1, 2018 to 6/30/2025 for 7.5 years. The contract will continue to support professional consultation and technical assistance services. The proposed amendment exercises the options authorized under RFQ 36-2017. Additional funding will continue to support the project-based consultant services modality. Reasons for change: the department is requesting approval of a total contract with contingency $3,430,326 due to the following: additional general fund in the amount of $366,953 for continuation of community referral networking project consulting for fiscal year 22-23, one-time additional carry forward from the CDC federal funding for fiscal year 22-23 in the amount of $149,200. This is for program administration support for ending the epidemic consulting program activities. Number 3, additional general fund funding in the amount of $422,518 for fiscal year 23-24. One-time additional California Department of Public Health state grant in the amount of $60,000 for the syphilis planning grant in fiscal year 23-24. An additional general fund in the amount of $422,518 for fiscal year 24-25. And an increase in the amount of $73,931 to the 12% contingency value applied for fiscal year 22-23 through 24-25. The previous contingency was $171,201, and the current is now $244,592. Please note the funding level of fiscal year 22-23 increased by $516,153 due to additional general fund, as stated, of $366,953, additional carry forward of $149,200. We have Nicole Trainer, who is the SOC Contracts Manager and Getting to Zero Coordinator for CHEP, the Community Health Equity and Promotion System of Care, who can answer any questions programmatic that you may have.
Commissioners, any questions?
I actually do. So because this is such a special contract, in terms of the scope of work, so I see that we are extending it to like 7.5 years total so far, like for this contract. And I think that, like we have made some, consensus that we would like to see contracts that are like extended to 10 years be the cap, and then they will go back out for rebid. But this doesn't seem to be, it doesn't seem logical, like for, like this consultancy, this kind of contracts to go back out for rebid. Am I correct?
You mean at 10 years or after the 7.5 years? It would depend on if these services are continued and if the consultant services that are being provided would be needed. You see that some of these services are related to, like the state syphilis planning and the ending the HIV epidemic, which will, the EHE funding is a 5-year grant from the feds that will continue for another 5-year term. I believe we're about to begin year 4 of that grant.
Okay.
So it's a question that could probably be answered by Nicole better than myself. It's
Yeah,
probably could be, but not
I'm just
necessarily.
curious because I'm just thinking on the practical side. I don't believe the epidemic will end in 2.5 years. So,
Sadly.
yeah, so, like just like looking into the future, I can see that, like we will continue to engage in this effort. But, how much do we depend on an outside consultancies versus, like developing our own expertise within this like time frame is something I'm curious about.
Right.
And would you like
Yes.
to? Yep. Yes, please speak, Ms. Trainer.
Could you, thank you, Commissioner. Those are really great questions. And you're right, the facilitation of the consulting service is actually essential to our ending the epidemics cross-branch and cross-jurisdiction collaborations. And so we do have expertise on subject matter experts regarding ending the epidemic activities. However, due to the complexities and the amount of funding received from CDC, one, we want to ensure that these funding gets out to the community, but we also want to ensure that our activities are in alignment with other jurisdictions within the Bay Area, and also our strategic plan is in alignment with the state plan as well. So that requires additional high-level coordination, which requires expertise from a consultant to ensure that all of our activities are coordinated in a meaningful way. And hence to try to get to ending the epidemic, not just here in San Francisco, but cross jurisdiction planning as well. And you're right, this work is going to continue past the 10 years. And just part of, DPH requirements, when we hit that 10-year mark, we're required to do RFP solicitation for these particular services. But consulting services such as Vicente is essential to our planning, especially the ending the epidemic activities, which are huge and can be complex, especially when trying to coordinate across several branches within the departments.
Okay.
I hear there's a static, so I'm not sure if you were able to hear me clearly. There's static on my end. So I
Yes,
apologize for that.
thank you, Ms. Trainer. I hear you loud and clear. So this is like one of those situations that, I was thinking out loud, like that since we have already extended to 7.5 years, is it possible, like to look at drawing a new contract when the 7.5 years end to just like make sure that we don't go into like any gaps in terms of like, I don't know, like, yeah.
We have the contracting authority to extend to the full 10 years.
Okay.
It's what the system of care prefers. We always have the ability to end the contract terms as needed based on funding or other decisions
Yeah, so
within the
rather than
department. So that'll be up to
doing
the system of care.
that little bit at a time, like I would prefer to see, that you give it the most.
Oh, I
Yes,
understand.
I don't know how to put it. Like, yeah,
The-
just
A fresher
go big or
solicitation.
go home, I guess.
Gotcha.
Oh, I'm sorry, could you
Nicole.
just Dean, just so for my clarity, I want to make sure I understand the request of the health commissioners. You would prefer to see the contract extended for the full authority term, or so that we,
Yeah, it's just for practical purpose, like rather than having, this bringing back to us like repeated times. Like if you actually give it the maximum, and then if we don't have to like do it, with the 10 years, then like we can cut it back, rather than coming every year and a half and do another approval.
yes, agree. Thank you for that clarification.
Yeah, so
theoretically,
that should make your life
Yes.
easier too.
Yes.
Yes.
All of ours. Point well taken, Commissioner.
Okay.
Thank you for that.
There, Thank you. I do want to point out there are some circumstances where we have additional carry forward funds that we need to add to the specific contract to for additional consulting services that may be for our community partners. And I think those are times where we may have to bring it back to the board if we're exceeding the current contract amount, but we'll definitely take this into consideration moving forward so that we won't have to bring it to the Health Commission so often.
Yeah, and it's just to like have more ways to support like different programs autonomy, rather than having everything comes back to us. We have had these discussions way back, to really trying to like make things a little smoother for departments, and maybe it's time to have another conversations to like iron out these like kinks and nuances.
Absolutely.
Yes, agreed.
We have those conversations internally within the department often, very, very often. I think what Nicole was referencing is that sometimes, even if we were to bring it for the full 10 years based on the amount of funding that we know of now, there could be additional carry forward dollars that would get added later that would require us to come back anyway. So it's kind of finding the balance of when to time that and when to roll it all together or wait for more dollars to come in later.
Okay, thanks.
Thank you.
Thank you.
So, if I could follow up on that question, I think that where the commission was in the past has been that although you have authority for 10 years, that normally we would like to see a 5-year period of time as being the first cut at the apple, let's say.
Oh, I see. Okay.
Then after that, and I think in this case, Commissioner Chung's making a big point that why are we only doing a 1.5 year? First of all, this one was 6 years. And then we're only adding 1.5 years. If in fact this contractor was a good contractor and we're feeling we're going to need all the services like you said we're going to need, then the question would be whether to really extend a longer period of time if it looks like we're going to be able to continue this. Now, of course, you can get trapped and we can say, well, why are you going to the full 10 years? But in your other contracts, you've taken the same approach, right? 5 years, and then you come back and say, they've been doing a good job. We're going to do 5 years before we do the rebid. And as you pointed out, then a rebid is really asked for within a 10-year period, or there is some reason that, you find this as a sole source or whatever it may be. As part of my question on this one, I'm assuming that you were pleased over the 6-year period, well, it's not been 6 years, but almost 6-year period of their operations. But in your other notes, you were very kind recently to put down where the evaluation was. And in this case, there is no note to us that these people, although you've given us good indication they've been doing a good job, but it would be nice that on the bottom there is some sort of evaluation again on this type of thing. That was where I felt that it would be really helpful, and we want to ask again about that. So I did send that question forward, and I don't know if you had an answer as to how the evaluation went over these 6 years.
I did not get an email
Yeah,
with questions.
Dr. Cho, I didn't get those questions from you.
Oh, you didn't get those?
I didn't get any Finance and Planning Committee questions from you. I apologize.
How sad. I have a whole list of them. Well, I'll ask them now.
Sure.
And so
I'm happy
the
to follow up.
question, and maybe
Yeah.
Nicole can answer it, is you obviously are adding 1.5 years, so could you just tell us how satisfied you were with the services that they are rendering, or do you have some corrective action plans that they're also going to be following?
Thank you, Commissioner Child. There are currently no corrective action in place for Vicente, and Vicente has met all of their deliverables within their contract and their units of service over the past years that we've been contracted with them, and CHEP is very pleased with their services. And in fact, we are trying to collaborate with them further to help us work on other program planning plans with people who inject drugs. And so we're trying to elevate their work to to some of the high priorities of the city. So they've been excellent with the work that they've provided for us.
Okay, thank you very much.
Thank you, Nicole. Yeah, Commissioner, if you want to send those through Mark, I'd be happy to follow up with any of those questions that we're not able to answer directly here today that you had intended
That's
to
fine,
send.
yeah. I'm sorry it didn't get to Mark. Next time we'll have to double check again what's happened to our questions. But I can ask him here today.
Okay,
Okay.
thank you.
Thank you.
And Commissioner Guillermo, do you have any question on that? All right, so thank you. So we can move on to.
Okay. The second contract is United Audit Systems Incorporated, sorry. The requested action is the approval of an amendment to an existing contract with United Audit System Incorporated to exercise a contract option to extend the contract term from July 1, 22 through 12/31/22 to July 1, 22 through June 30th of 2025, which will continue existing services for SF General's Hospital Information Management System unit and add remote coding support services for DPH's Behavioral Health Services section. The amendment, the amended contract amount with contingency is $5,240,680. United Audit System is an approved Vizient Group purchasing organization selected following a solicitation conducted by Vizient. Prior to the subject contract, DPH had a contract with United Audit System for the ZSFG-based services only, which expired June 30th of 2022. This contract was approved by the Health Commission on August 3rd, 2021 for a contract ending on June 30th of 22. Upon expiration of the original contract, it was not extended because Vizient was conducting a new solicitation process that wasn't to be effective until July 1 of 22. At the same time, DPH only had contracting authority from the city's Civil Service Commission to contract out these services through December 31st of 2022, or 6 months short of the full year that we had hoped for. As such, the department entered into a 6-month contract to continue services pending the extension of DPH's Civil Service Commission approval to contract out these services. The original new 6-month agreement was not brought to the Health Commission for approval. Today, the DPH is seeking approval for the proposed amendment that will align with Vizient's solicitation authority and the Civil Service Commission approval through June 30th of 2025. Additionally, the subject amendment will support the expansion of these services to also support BHS through the implementation of the state's CalAIM initiative that is significantly changing billing requirements. The increase in the contract amount is the result of the extension of these services and the addition of services in support of community behavioral health services. The annual difference is $75,708 and is due to the additional services for BHS, which is at $75,708 for 3 years would be $227,125. The contract rates remain the same. And the change in the total contract amount of $4,394,520 is due to the extension at ZSFG for $3,777,500 and for the BHS amount of $227,125, as well as a contingency of $389,895. If you have any programmatic questions, we have Diane Lovko-Pramo, who's the SFHN Director of Health Information Services. She's joined remotely, and Tammy Higginson, who is here in person, the Director of the SFHN Revenue Cycle, and also Wayland Bergman of DPH IS Project Director is here for any BHS-related questions you may have, or he's attending virtually. Thank you.
Commissioners?
I had a question.
Yes.
I had two questions, actually.
Okay.
One is, I'm not, the first question is the role of the Civil Service Commission in providing DPH the authority for a subcontract. Is it because of the overall group purchasing?
No, actually, that's a really good question. Whenever we're funding a contract with a community-based organization that is for services that are potentially rendered by a civil service classification, that has to go to the Civil Service Commission for review and approval, and we create a PSC for that amount for those services for a specific contract or contracts and for a period of a certain amount of years. And we have to go back to the Civil Service Commission to extend the dollar amount or the term, or of course for any new ones.
Are there many other, I don't recall seeing the relationship between DPH and civil service on an authority before, so I was just curious as to what the distinction is. And it's still not quite clear to me what the civil service relationship is for this particular contract.
They have overview over the civil service staff within the entire city system. So anytime we enter into contract with a provider where there are positions that are being
okay.
funded that are potentially also existing civil service positions, that has to be reviewed, questioned, and approved. And the unions are involved in that process as well.
Okay, I get it. It's because of the nature of the kind of positions that are being affected by this contract that are civil service positions.
Correct.
Right,
And in this case, I believe it would be those that are doing the coding for the billing.
The billing and the
Yeah.
coding, right?
Yes.
So the second question, thank you for that. The
Sure.
second question I had is, the coding and the revenue cycle are sort of in the same contract with this particular, with United Audit Systems?
I'm going to step back and let
Okay.
Tammy answer that directly because it's a program question for her.
Hi, can you repeat the question?
So the coding and revenue cycle are this basically part of the
Yes.
same process?
Coding
right,
is
right.
a mid-revenue cycle
Right.
process.
So then my question has to do with, I guess, the security with regard to, I guess it's the United Audit Systems, sort of information technology security, because we're dealing with, patient records with
Correct.
an outside vendor and so on. And do we have an assessment of, or any issues that have come forward?
In terms of security, they do go through a very rigorous process with IT to make sure that everything's HIPAA compliant and all patient data is safe.
Okay, so because we've heard in the past, not for us, but lots of health systems have had issues with regard to outside vendors and patient records and information, particularly as it relates to revenue cycle and billing. And so I just want to make sure that that's something that we're always very clear.
Absolutely. Yeah.
monitoring.
We go through a very rigorous security process with all our vendors that might have access to our medical records.
Thank you.
Yeah.
I had a further question, which actually relates to this original new 6-month agreement was not brought to the Health Commission for approval. This kind of harkens back to the whole NEMS issue. Does that mean these people were not paid, or they were paid without a contract, or under what authority did we then? Is the contract less than the amount that you need to bring before the Health Commission?
Hold on a second. I believe the 6-month contract should have come to the Health Commission, and it was due to some staffing change within the contracting section that was working on this. But I'll double check. It could have been that perhaps the 6-month amount at that time was under the cap that triggers requiring Health Commission approval. I will follow up
Okay,
and send that through more.
Because you just, you had replied to us from our past meeting about NEMS that they weren't paid during that period of time for the
No.
contract, so I'm curious as to whether, it could fall under the contingency number here, which is fine, but appreciate your response to that and everything that you've been saying. Again, it would be nice to have a little note like you do for many of our other contracts that they have been very satisfactory, or they're, have met their guidelines, or they're superior, whatever it is. Okay,
Got it. Thank you, Commissioner.
thank you.
Any other questions, commissioners, or
No,
comments?
we can move on to the
Okay,
next.
thank you. Contract 3 is Health Right 360 for check writing. The requested action is the approval of an amendment with Health Right 360 for an amended term of January 1/21 through 12/31/25 and a not-to-exceed contract amount of $109,545,131. The purpose of this contract is to issue payments to non-DPH entities for critical services that are not conducive to the creation of contracts. This contract serves the target population by paying providers who, because of their size or location inside and outside of San Francisco, are unable to contract with the city to receive reimbursement for services throughout the city's contracting process. This contract issues payments to out-of-county private providers serving San Francisco mental health plan clients requiring treatment while outside of San Francisco, to license residential care facilities for the elderly, for client wraparound related services, emergency housing, workforce training, and for expenses related to the Parent Training Institute. Health Right 360 is issued reimbursement at a rate of $22 per check. Of the total annual amount of $22,202,534, it is expected that approximately $50,000 annually will be paid for through the per check fee of $22 per check issued, with the balance of the funding used for direct expenses. The contract is authorized under RFP 16-2019, with the contract expiring 12/31/25. The funding authority, RFP 16-2019, has a term of 8 years and will expire 12/31/2028. This contract was previously approved by the Health Commission on October 6th, 2020, and this proposed amendment is subject to approval by the San Francisco Board of Supervisors. The reason for the funding change, the department is requesting approval for the total contract amount with contingency of $109,545,131. The proposed increase of $4,397,813 is due to the following: $3,375,375 in additional funding for additional beds at long-term elder adult residential care facilities or skilled nursing facilities. $759,625 in additional funding for skilled nursing facilities board and care rate and census increases. $45,921 in additional funding for pretrial mental health diversion state grants. $25,000 in transitional age youth mental health work order program funding. $150,000 in Mega Black funding and $100,000 in MHSA funding for intern training. $53,900 in general fund for interim training, and a reduction of $112,008 for adult emergency room stabilization rooms. Should you have any questions, Kelly Hiramoto, Special Projects Manager and PSC Coordinator with the DPH Business Office, is here to respond.
Commissioners, do you have any questions?
I had several that I actually was going to forward, but I didn't. One was first on the monitoring of the contract. It says that it's monitored by BHS rather than the business office, and yet I think you just told me that the business office was involved. So I'm not sure who is monitoring this contract, but a greater question is the memo that you sent us concerning the financial analysis of Health Right 360, which was very informative. It would have been better if we also got a total of how much the contract was. I mean, it says that they actually have about $150 million in expenses, but we don't really know if they were granted $200 million or $145 million. But aside from that, this is just an enormous number of services again, and this is just one of two contracts coming up. And additionally, there is indication that there is concern over the financial issues that Health Right 360 is facing. So I come back to that question. We're continuing to give more contracts or continuing contracts when there seems to be a question that it says BOCC doesn't monitor it, yet it says in this memo that BOCC is involved, which is good. because that was my first question, because BOCC should be involved. And number two, perhaps it would be at a different time, but we need to understand if we're giving contracts to people that have some financial issues, and there's been plenty of publicity about city commissions giving contracts to people who are not in a fiscal position, a sound fiscal condition. What is the reason, or are we looking for other contractors? I mean, check writing is not an exclusive talent that Health Right 360 has. I'm sure there are other agencies that do check writing.
Well, they were selected through a solicitation process, so
Okay.
that was the determination of that. The BOCC is involved in monitoring HR 360's many other programs, and the overall financial report that you have there from Wasim Samara
Yeah, very good.
is part of the BOCC process as well, and that covers all of their contracts. But for this particular service, there's no site visit and monitoring report developed by BOCC because it's internal. It's monitored by and evaluated by BHS leadership and how well they provide the services, how timely the checks are issued, et cetera. Kelly, do you want to add anything to clarify?
So how does that coordinate with the BOCC? If BOCC is not looking at this, or perhaps several other of these multiple contracts, how do they get a total picture also of whether or not, you know, the performance is up to snuff? Is it that a report goes back to BOCC about it, or you know, I'm not saying they have to directly look to see if these checks have been issued and so forth, but one would think that there was some sort of performance that's going on. I mean, $150 million worth of services
Of check writing
expended
services.
is a tremendous amount.
It is. I would imagine that if there were an issue with the timeliness of the checks being written or the responsiveness, that we would have a conversation with the BHS leadership that relies on these services to be administered for these various functions for which things are paid. But as far as a formal system, I would have to follow up with Michelle and let you know what kind of apparatuses and systems might be in place.
And what would be the mechanism, as this is a contract from 2021, so granted the RFP was, you know, issued at that time and they became a provider, but now they're, perhaps in that time they were too, but now they're on a moderate list program. So, and then you're asking now for an amendment to it. So I'm just wondering, because we qualified somebody for so many years, then they can continue to qualify for additional services that we're talking about? Or should we have then said this represented something that should have gone out again, or perhaps to another vendor, to avoid having such an aggregate of services within one agency? I mean, what makes that decision?
Okay, I'll let Kelly Hiramoto respond to that. Thank you, Kelly.
Good afternoon, Commissioners. Kelly Hiramoto, Special Projects Manager with the Department of Public Health. This contract is actually, this RFP is getting ready to solicit. We're actually on the cusp of getting ready to issue. So your point is valid that it's time to sort of put the word out there that if there's an opportunity for other agencies who want to do check writing support to be able to do so. The other thing that we've been doing is really looking at the things that are in the check writing contract and some of the services like the boarding care facilities, and some of them are a little bit larger contracts amounts. As time has passed, the value of those services is growing, and so we're looking at pulling those things out that can be standalone with entities that have sort of grown as time has passed and have better infrastructure and could actually enter into a contract and become a supplier with the city through the normal channels. As those have also become more streamlined, we're going to be trying to see if there are some entities that could actually become standalone contracts separate from being within the check writing umbrella. So both of those things are taking place currently, so we can hopefully bring this to a more manageable size.
Okay, no, thank you for the update.
I had a similar question. I was going to wait until the other contract for Health Right 360 came up in terms of there being a fiscal intermediary.
Yeah,
But
it's a
I
little
think
bit different.
There's a
Yeah.
relationship here. So the report that was submitted indicates that there's cash flow is not an issue with Health Right, but the accrual basis. So that means it's probably debt related
Yes.
on the accrual basis. So it does bring to mind the question around if they're going to be a fiscal intermediary and they have to service their debt, will that eat into their ability to be the fiscal intermediary? Even though they have, the ability to write checks because they have good cash flow,
Right.
if they have to service their debt when it comes due, that might eat into their ready cash. So again, something that we really need to monitor or understand better for an agency like this that I think is probably outside of UCSF, the largest contractor for the Department of Public Health,
Yes.
and increasingly so.
Yes.
So it is definitely something that we're concerned about as members of the commission on behalf of the public. And so I'm not quite sure where we get the ability to go deeper with the issues around their ability to maintain good status and good performance as probably the major contractor for the Department of Health. But it does worry me when I see that they've got cash, which makes sense because they keep getting contracts, but they can't service their long-term.
Right. I think that plays into the fiscal monitoring report that Mr. Wasim did for us. So that right now shows that they're doing well. But we are continuing to monitor. So we do those fiscal monitor reports on a regular basis to really look at their overall health, which is what you're speaking to. So we do keep an eye on.
Right. And then, but the related question for the commission is, at what point do we start to need to take, I guess, a greater sort of responsibility for monitoring the funds that are going out to a, if things don't continue to go well.
Kind of what are the red flags when we would see
Right,
the fiscal
so-
monitor report to say it's time to take a deeper look at what they're
That,
doing?
and then the role that the commission will have to play in order to be able to take appropriate action.
We can certainly report back to you what those red flag moments are when we would bring it back to the attention of the commission.
Thank you.
Any other questions, commissioners? I think we can move on to the next.
And Commissioners, I'm noting these questions, and it may be, I'll check back with you after the meeting to see if it makes sense to have an item just on the committee agenda to talk about these meta things and possibly bring it to the full commission after you all have a discussion so that it can be a more robust process, because I'm hearing the issues come up again and again.
Yeah, that's a great idea. Thank you, Ms. Morowitz.
Okay, item number 4. Item number 4 is the, sorry, step at her. Item number 4 is the Homeless Children's Network. Requested action is approval of an amendment with Homeless Children's Services, Homeless Children Network for an amended term of July 1, 2018 to 12/31/2027, and a not to exceed contract amount of $17,465,320, an increase of $7,473,593, and to increase the current 5-year term of July 1, 18 through 6/30/23, and to extend to the end date through 12/31/27, a new term of 8.5 years, an increase of an additional 3.5 years. The services are ongoing and were awarded to HCN under RP 1-2017 for early and periodic screening, diagnosis, and treatment, EPSDT, and also through RFP 16-2018, Early Childhood Mental Health Consultation Initiative, or ECMHCI. RFP 16-2018. Solicitation for the ECMHCI expires in fiscal year 23-24 and will be resolicited by DCYF, the Department of Children, Youth, and Families. And afterwards, these services will move on to a new and separate contract. The services in this contract were last approved by the Health Commission on February the 1st, 2022. The purpose of this contract is to provide mental health and housing services to youth ages 0 to 17 and their families in transitional and homeless care facilities. The contract also provides support to shelter-based and homeless child care providers and staff who provide care to homeless youth and their families. The proposed amendment is subject to approval by the San Francisco Board of Supervisors. The annual increase of $738 includes the following: $57,188 for a 4% annual CODB allocation, $8,988 an expansion of MHSA funding in the ECMHCI program, and $111,562 in additional work order funding, and $100,000 in EPSDT funds for the LGBTQ program. Chris Lavoie, who serves as Assistant Director of the Children, Youth, and Family System of Care within DPH, is joining us remotely and able to respond to any questions about this contract or program you may have.
Commissioners?
I'd only comment that I really appreciate the monitoring report that I've said before, and that is very helpful. Thank you.
Thank you.
Thank you.
Commissioner Gill?
None.
Okay, so we'll move on.
Okay. Next one is item 5, Community Forward SF. Requested action as approval of Amendment 2 with Community Forward SF for an amended term of July 1/18 through 12/31/27, and not to exceed contract amount of $26,177,617. The services in this contract are approved under RFP 8-2017, the mental health services, and RFP 26-2016 for substance abuse programs. The Health Commission last approved this contract on June 7th, 2022. The purpose of this contract is to provide residential and drop-in substance abuse and mental health treatment services to homeless adults and seniors. Specifically, this contract for Women's Place has a target population which focuses on low-income, chronically homeless women of diverse sexual orientations over the age of 18, with a special emphasis on women living in the Tenderloin, South of Market, and Mission districts of San Francisco. A Women's Place treats women who abuse substances, suffer from mental illnesses, and are victims of violence, have HIV, and/or involvement in the criminal justice system. The proposed amendment is subject to approval by the San Francisco Board of Supervisors. The reason for the funding change, the increase of $508,814 includes a 4% annual CODB allocation of $92,624, a one-time 22-23 Board of Supervisors add back for Women's Place and drop-in program of $1.5 million, a reduction in funding for the COVID shelter in-place hotels 11 and 16 of $1,087,810. If you have any program or contract questions, Eric DeBone, project manager for the Substance Use Disorder Services, is here to respond. Thank you, Commissioners.
My only comment is, based on the monitoring report, it looks like this is a contractor that seems to be having performed well through COVID and up to the present. So nice to hear that.
Yes, very much. Thank you, Commissioner.
I'm wondering the unduplicated count, or the number of people who were served, actually is not listed here. I mean, there is, and yet we have services which certainly are needed, and so it's kind of nice to know how many people we're really serving. And I don't know why it's not on the list here as giving us an unduplicated count. It just well, it's just a line missing.
Yeah. There was a corrected version sent. If you look at the, it says UOS, but that should be UDC in that line. And for the Women's Place Substance Abuse Program for the residential recovery long-term, There were 55, the target UDC is 55. For the drop-in, it's 230. And for the mental health program, it was 157
Oh,
clients surveyed.
thank you.
You're very welcome.
Okay.
Any other questions, Commissioners? I think we can move on to the next.
Okay, item number 6. This is the Health Right 360 fiscal intermediary contract. Requested action as approval of an amendment with the term of January 1, 2014 through 12/31/23, and an amended not to exceed contract amount of $83,192,976. The fiscal intermediary services were awarded to HR 360 under RFQ 16-2013 and were last approved by the Health Commission on November 16, 2018. The purpose of this contract is to provide fiscal intermediary services, human resources, accounting, budget, fiscal, contract, quality assurance, compliance, and administrative services in support of outpatient and residential mental and substance abuse treatment to San Francisco residents for the period of January 1, 2014 through 12/31/23. This proposed amendment is subject to approval by the Board of Supervisors. The reason for the funding change, the increase of $305,799 includes the following increases of $239,340 to the Street Violence Prevention Program, for adult mental health comprehensive crisis bereavement, $5,998 in increases to the Treatment Access Program and Methadone Van, $28,568 in additional funding for the Black Infant Health and Community Wellness Programs, $14,853 for the Jail Health, and $17,050 for the Youth Guidance Center, as well as a 4% cost of doing business funding is included. And again, if you have any questions, Eric DeBone, Project Manager of Substance Use Disorder Services, is here to answer.
I have a question. The technical assistance work plan that was initialized in 2019, would you say that that was responsible in large part or in small part to the improvement in the financial status of West Side?
Wasim, are you still attending virtually? Are you potentially able to respond to that question?
Hello, Wasim Samara here. I am virtually. Sorry, can you repeat the question?
Could you repeat the question, Commissioner Guillermo?
Oh, sure. The technical assistance work plan that was initialized in 2019, would you say it was in large part or in small part or somewhere in the middle responsible for the improvement in West Side's overall financial status?
Yes, so West Side actually is one of the agency that has been, financially troubled, for a while, and I think there was multiple technical assistance offered like throughout the years. The last one being the one in 2019, and based on, this is an agency that we continuously monitor very closely financials, and there's always discussions with the controller's office and with other city departments around their finances. And the good news is the last 1 or 2 years actually have been very positive for them in terms of financials. So the follow-up on us now is just to make sure that the improvement kind of continues, and for them to kind of get out of the hole and build their reserve.
The reason I asked the question is if it was due to the intervention of the DPH in the in the assistance for West Side, then I'd want to see that we have the ability to do that with other contractors that are falling behind in terms of their financial status, and to do it more proactively as opposed to waiting until there's a going concern on the audit. Because it would seem that it is to our benefit and the benefit of the clients that are served to, again, if we are effective in stepping in, to do that, I guess, at a earlier date, as we're consistently monitoring the financial status of our contractors.
That is definitely the goal. That's kind of why we started doing more of these analysis and looking at like longer time horizons, looking at trends, because we are trying to kind of proactively, catch agencies that are trending downward as opposed to, waiting for the last minute. And in the past, there has been other interventions from technical assistance and from DPH that actually was very successful for other agencies. Obviously, there was one or two agencies that was on the headlines and things. Perhaps we didn't intervene at the right time in the right way, but this was West Side. We've been intervening for many years, and we are doing more and more analysis and looking at more and more trends to try to do exactly what you're saying, is kind of catch the agency before it gets very serious.
Thank you. Appreciate that.
Thank you, Wasim.
Thank you.
Yeah, this contract ends in December of this year. So is it that we're making the amendment because these are added back in the past year, but that we're going to go out to bid for these services?
Yes.
Okay.
These services are in the process of being resolicited summer/fall, so a new contract can be in place by January.
All right. No, thank you.
If there are no more questions, we can move on to next.
Okay. Number 7 is Moss Adams. The requested action is approval of a contract amendment with Moss Adams to increase the total contract amount to $9,987,293, an increase of $5,861,213, and to extend the contract term from December 11th, 2021 through December 10th, 2023 to 12/11/2021 through 12/31/2024, or an extension of 1 year and 3 weeks for a total contract term of 3 years and 3 weeks. The purpose of this contract is to provide DPH managers with lean management consulting services, including Hoshin strategy deployment. That should be capitalized. My apologies. HOSHIN. Hoshin strategy deployment, communication strategies, and project management. Hoshin strategy deployment, also referred to as Hoshin Conry, also called policy deployment, is a method for ensuring that a company's strategic goals drive progress and action at every level within that company. This contract was initially approved by the Health Commission in December of 2021 and is authorized by the enabling solicitation RFP 10-2021 for lean consulting services. The department is experiencing a heightened need for these services in conjunction with the recertification effort at Laguna Honda Hospital. This requested increase in funding is made in order to greatly expand existing Moss Adams services to meet that need. If you have questions, Baljit Sangha, Chief Operating Officer and Deputy Director of SFHN, is attending remotely and is able to respond. Thank you.
So my question is programmatic. We have HSAG and we have HMA. Where does Moss Adams fit into this? Because as your final description shows, this is for remediation of all plans of correction, and I thought that's also what HSAG does, and not quite sure that HMA, how it is involved with the action plan. So now we're adding another we're continuing another consultant. I understand the idea of teaching people lean, but what roles do all these three groups play?
Good afternoon, Commissioner Chow. Thank you for the question. So HMA is not involved at this juncture of the action plan implementation and the milestone tracking process. So HSAG is our expert consultant group, as we've been sharing from for the better balance of the last year, around the CMS regulations and skilled nursing facility environment. They have been providing the expert consultation around root causes, identifying the additional opportunities, where we actually need to go as an organization, and then what is our plan for sustainability. Now, Moss Adams comes in, and they're coming in to complement that effort. So the Moss Adams team, as described by Mr. Goodwin and is listed in the summary documentation, they are providing the daily management system support. So, for example, let me know if you like further depth, but I'll give it the first swing here at this current depth, which is, daily management system is really the DNA for how the ongoing improvements are sustained over the coming months and years. That involves our daily huddles, that involves our leadership DMS, or how we are rounding, how we are engaging, how we're reviewing our data. That work, long after HSAG is gone and has moved on, that work that's being conducted by Moss Adams is the work that we're investing further in our future leaders of how then do you actually conduct and sustain this work. So we know what we need to do thanks to HSAG. We know why we need to do it thanks to HSAG, and we now are leveraging the Moss Adams team to help us sustain that. The other key component, though, around this is that the Moss Adams team, they are serving as our process improvement managers, and they are supporting us with the actual volume of work that is currently underway and has been underway since we were decertified, for pulling up the documentation, doing the active work around making sure we hit the milestones. We are submitting them back to the quality improvement expert, and we're hitting the expectations of what CMS expects us to hit by our May 13th action plan date. So Moss Adams is doing a couple things. The latter part I just explained is this spike in work, the spike in volume of effort that on a regular day in a non-action plan environment, in a non-decertified facility environment, would not have existed. But because we are where we are and the work that we're doing now, that's where Moss Adams fits into that part of the puzzle. But again, once we're recertified, that component would have gone away, and we will not see that as like an ongoing component of work.
So the latter, just to pick up on this Moss Adams spike, are they then part of the team that is answering the 400 milestones, or and how does HSAG involved in that, or is HSAG involved in reviewing it, but Moss Adams actually assists staff in creating the answers to the milestones?
It's the latter. The Moss Adams staff is supporting us in creating the answers for that. And by creating, it's that, our own staff are the ones that are working and identifying that here is the countermeasure. The root cause was identified, a milestone was established to now meet the countermeasure for the root cause. And then the Moss Adams team comes in and supports in their process improvement of, for example, X report needs to be developed ongoing, and we have not developed that for several months, and the reason being is that's why we find ourselves for a certain root cause. Now the Moss Adams team, with their lean expertise and that Hoshin Connery expertise, comes in and says, okay, how do we eliminate the waste from this process? How do we not have ongoing plethora of Excel documents coming in every morning or every day or every week, but how do we actually streamline this in a way that makes the information more meaningful? It's done in a strategic way where we can build on this moving forward, and then that data actually turns into information. We're actually reviewing it at a morning huddle, for example, with the medical staff, or the morning huddle with the nursing units, and the huddle boards that are actually upcoming and being put into place. So that's the work that is being done with Moss Adams. The first part of your question was HSAG component. And so as you'll recall, there are two components of HSAG. The one compartmentalized component of HSAG, where they're serving as a quality improvement expert, and they're reporting into CMS. That is the group that they are the recipients of the milestones. They are reviewing it. They are really more the adjudicator and the judgment of what is being submitted and if it meets muster. Then there's a separate component of HSAG, which is partnering with our leaders on the ground around what we need to do. So when we say, for example, physical restraints, we need to reduce physical restraints. and here's how, and here's the methodology to get there. They can show us what we need to do, and they can teach us one time on how to fish, but now we need to develop the actual programmatic processes to then ensure that we are teaching ourselves and we are fishing for the coming months. And that's the part where Moss Adams complements.
So I hadn't realized Moss Adams has such expertise, because normally we've thought of them as an auditing company. Is this a separate arm of Moss Adams, and
Correct.
done this for many other people?
Correct. Yeah, this is not being too familiar with the organizational structure of Moss Adams. I do know that this component and this team, they are the healthcare services side of the group. I believe that's a group that in the past a couple of years has grown, but this is not what we traditionally hear Moss Adams in terms of financial auditing and an independent kind of compliance. You would hear more with traditional profit losses, ledgers, and the statement evaluations.
Okay, well, thank you for helping explain where the Moss Adams work comes in. I don't know, Commissioner Guillermo has also other questions as our chair over at Laguna Honda.
I guess the question stems from, we've heard so much about the other consultants and the role that they've played. We've heard very little about Moss Adams and the role that they've played, especially considering, as you said, Baljeet, that they are known for the other parts of their business more so than this one. So it would be, I think, important, particularly for the JCC, to hear more about the role that they're playing alongside with management in sort of the development of the operational details of implementing the plan, particularly as we get closer and closer to all the different deadlines that we're having to meet.
Absolutely, I could definitely take that back, and for the next JCC to have a component that just calls out a little bit more how this service has been utilized for the past 11 months and what our plan is for the next several months. And then also, I think the ongoing request from the commission has been just a sustainability plan. When this group goes away, then what? And so I'll make sure to add those components and take that back to the JCC team.
Thank you.
I have no further questions.
Thank you. Move on to the next
Okay.
item.
Item number 8 from the monthly report is the Westside Community Health Center methadone contract. Requested action for approval of an amendment to the contract with Westside Community Mental Health Center, which provides the San Francisco Department of Public Health with methadone treatment services for opiate addiction. The goal of the treatment program is to provide methadone treatment for opiate addiction to reduce the impact of opiate abuse and addiction on adults who are emotionally, physically, and socially impaired due to the use of opiates. The contract was previously approved at the July 5th, 2022 Health Commission meeting. The total contract amount with contingency that we are requesting is $15,580,935 with a term of 7/1/2017 through 6/30/2026 for a total of 9 years. This amendment continues to be funded under RFP 26-2016, and this contract is subject to approval by the San Francisco Board of Supervisors. The reasons for the funding change in the amount of $15,580,935 with an increase of $210,834 is due to a few changes. One, the contract was last approved at the Health Commission. An amendment was required to extend for a year from 12/31/22 to provide additional time to return to the Board of Supervisors for their approval. There was sufficient unspent funding that year and previous years to allow the extension to occur to align and implement planned increases by the system of care. The proposed increase of $210,834 and reduction of the term from 7/1/27 through 6/30/27 to a term of 7/1/2017 through 6/30/2026, is to align with the proposed contract amendment moving to the Board of Supervisors for approval next month. Again, if you have any program questions, Eric DeBone, Project Manager of Substance Use Disorder Services, is attending virtually, and he will respond.
You realize I jumped the gun on asking a question about Westside before the
You
presentation.
know, it translated. It was a relevant question in regard to the HR 360 contract was how I interpreted that. But thank you.
I don't have
Commissioner.
any additional questions on Westside.
Okay.
what sort of realignment is this? Is this a technical issue? Because now we're actually taking away a year in the contract.
It's a technical issue. You had approved it initially as it was getting ready to go to the board last year, right before I came into this role, and there were potential changes coming to with additional funding. We saw that there were savings available that allowed us to extend the contract for a year based on your approval. So we had more time to get more detail on the funding that was needed. So the changes here are to increase the amount based on what's going to the board and to reduce it by a year so that it will be copacetic and match.
Okay, thank you.
You're welcome. Any other questions? Okay, moving on. Number 9 is the Mount St. Joseph and St. Elizabeth contract amendment to increase the total contract amount with contingency to reflect $20,601,207 and to reflect a new term of January 1, 2018 through June 30th, 2027 for 9.5 years. The Health Commission previously approved this contract on February 6, 2018. Contract supports Mount St. Joseph St. Elizabeth, which provides residential drug treatment program. The proposed amendment is authorized under 2 RFPs, 26-2019 and 1-2017, which were issued on October 21 of 2016 and March 24 of 2017. And again, this is also subject to approval by the San Francisco Board of Supervisors. The reason for the funding changes or the increase is to reflect the extension of the term for an additional 4 years. There should be 2 DPH staff available remotely if you have questions. We have Eric DeBone from Substance Use Disorder Services, as well as Allison Lessbatter, Program Manager with Children, Youth, and Family System of Care, are able to respond to any program questions you may have.
Any questions, Commissioners?
I had a question on here in regards to the services and the differential in costs between the Cook Lane, which apparently deals with 2 unduplicated patients, and it runs at about $400,000 plus per unduplicated person, and the new 24th Street, which is only for the same 2 people listed for only $269,000. So are there different services in these, or this is a significant difference, and normally we would think services within the city cost more than services outside, and so if the a number of people being taken care of are 2, why is it that one actually costs much more than the other?
Isn't that the Seneca contract?
Yeah.
I think you might be looking at the
Yeah,
wrong.
that's a different contract.
Oh,
We're on the Mount St. Joseph, which is
Oh,
17 and 80 and 20 UDC, Commissioner, I'm sorry.
It's on page 9.
No, I'm sorry. Let me retract that. On that one, I had a question that you had a 15% increase in service cost per year. And so that's greater than the cost of living. What exactly is that composed of?
Allison or Eric, are either of you able to respond to the Commissioner's question about increase in service costs?
The only guess, the guess I would take is that there was a rate increase due to just a general rate increase that we needed to give to our programs to be able to maintain staff and increase salaries.
Yeah. Okay. I guess that's important to do. I have no other questions on this one. I guess, opened up the Seneca one.
Any questions? So we can go to
Thank you,
the
Allison.
one that Commissioner Chow has a burning question.
Okay, let me read it real quick just to set it up for you. So the Seneca Center is the last item on the monthly report to amend the previously approved contract to continue its intensive therapeutic foster care, or ITFC, and their comprehensive assessment and stabilization services also referred to as Compass, for Cuck Lane in Petaluma and adding a new location on 24th Street. These are ongoing services previously provided under an existing Seneca Center contract, which were recently solicited under RFP 3-2022 for continuum of care. Seneca Center was reselected, and these specific services became part of a new standalone contract. The Health Commission previously approved this on June of 2022 for $4,307,725 for a term of July 1, 22 through June 30th of 27 for 5 years, as we discussed earlier. The proposed total contract amount with contingency is $9,672,97, and the term remains at 5 years. The proposed agreement is to add $5,364,372, an annual increase of $1,243,671 to add an additional location on 24th Street, which was not included in the previous contract approved by the Health Commission. And with that, Commissioner Chow asked a question
I'm
earlier about
back
the
to
small
asking the
UDC of
cost.
2. Yeah.
Should I answer the question, Commissioner? It's the question you asked before, right?
Yes, correct. I'm sorry that I was one ahead.
That's okay. It's always good to move forward. So this is a very unique program, the program on 24th Street. It's something called a short-term treatment center for one. The state is looking at doing treatment centers for just one child. And our child welfare department is subsidizing that program with non-Medi-Cal rates. And so they're setting the rate to the agreement that they had with child welfare. The idea behind the residential treatment center for one is, I think that the commissioners are aware that there's a huge shortage of residential treatment centers in California for youth who have complicated problems. And in addition to that, the departments of juvenile justice and child welfare have been forbidden from placing out of state. So we are trying to come up with creative solutions on how to treat our most complex kids. And the idea of a treatment center for just one child is something that Seneca is now doing. And this is reserved for, of course, the highest needs child who don't have other placements for, and who needs a lot of special care. So the rate is very high.
Oh, I think that's a very good idea to try. My question was related to, if you go back to the Seneca Compass Cook Lane staffing, it costs, apparently, if you're saying there's a UDC of 2, it costs several times more than what you're setting up here in San Francisco. So are there additional services over at Cook Lane that are not part of this program that you have here in 24th Street? Because it kind of describes similarly.
Right. Well, the Cook Lane has 2. The San Francisco program has 1. And in the Cook Lane, they do a lot more. They have to do a lot more travel and wraparound because they're taking the kids back and forth to the city for appointments and for family visits, where it's much easier here in San Francisco because the community is right here.
Okay, so the UDC, however, says 2 for both.
Oh, it shouldn't say 2 for both. That's a mistake. The 24th Street should just be, UDC should just be 1. Well, it could be 2. I'm sorry. Let me apologize. I guess it could be an unduplicated account.
Right.
2 per contract, for the term. And the other one could be.
Is it 1 at a time, but 2 over the course of the fiscal year?
Over the
Allison?
course of the fiscal year, yeah. I'm sorry, I apologize, yeah.
No worries.
2 over the course of the fiscal year, but it's 1 at a time.
And would that be true for Cook Lane, or they actually have 2 at a time? That
Well,
could
Cook
help
Lane was
explain.
designed to have more than 1 at a time. It was designed actually to have 3 at a time. They were having problems staffing it, so it went down to 2 at a time.
And in their case, I mean, it's possible if they have an amount of $900,000, and granted there might be travel expenses and all, that still seems disproportionate to the approximately 250,000 even for one.
Well, it's also for a shorter time because that 24th Street location just got started. It got started late this year, so it's prorated.
Oh. Okay. All right. Well, so the services are similar. It sounds like a great experiment to try to open up something in the city. And so
Yeah.
what are the future plans if that is successful?
Well, then we'll keep it going, and then they're going to try to open up another location in Oakland. They have one in San Francisco, and then they're going to try to have another location in Oakland.
So these are with state funds generally?
Yeah, they're with, it's a blended funding stream between us and child welfare. Part of the funding stream comes from child welfare. It's called $4 dollars. It's what kids who are in child welfare system get for board and care. So there's that in there. There's also general fund money from child welfare, and there's EPSDT from us in it.
Okay, well, very good. I'm hoping that'll be successful. Thank you.
Thanks for your encouragement on that. We're all pretty hopeful, and hopefully it'll be the end of a hard year.
Thank you, Allison.
Any other questions, commissioners?
Any questions? If not, do we have a motion to recommend this contract report for approval?
I would second that.
And before you vote, if you may check the public comment. Sure. Folks on the line, if you'd like to make comment on this item, which is item 3, the monthly contracts report, please press star 3. Star 3. All right, no hands, so commissioners, please feel free to vote.
Okay, so we have a motion and a second. All in favor, please say aye.
Aye.
Aye. So we will add this to the consent calendar for approval. Thank you.
Thank you.
Thank you all. Item 4 is a request for approval of a new software contract with 3M Health Information Systems Incorporated. And I'm not, is Tammy going to be presenting?
Yeah, I will turn this over to Tammy Higgison, who's here in person, to give a little bit of background.
Hello again, commissioners. The purpose of this contract is to procure the required software for integration with our electronic health record to allow coding staff to assign the most accurate codes in alignment with billing compliance per state and federal guidelines. Our current contract is expiring, and again, the software is essential for proper coding and billing on a daily basis.
You've selected this through a RFP process, but
Yes, sir.
I'm curious that there have been a lot of recent press about such types of coding programs. Was that in consideration also in terms of? I guess the government's concerned about us as a provider overstating what this is. So I gather in the evaluation that this was looked at and that 3M has a good track record of not sort of aggressively pushing the envelope in terms of
Yes, sir. I'd say that's true. They have about 40 years of experience in coding alone, and 35 years experience working with governmental bodies.
Oh, okay.
Yeah.
I don't know, Commissioner Guillermo, have you had experience with 3M?
Excuse me. Not that particular, I'm familiar with the name of the company, but not in my experience with other systems that I've been in. But I did have the same question, though, around the security of patient records and such, and any instances where 3M as a company has been exposed or has exposed any patient data.
To my knowledge, no. The company is quite large. I would imagine that would be very well known. We do have a representative on the call if you want him to speak to that, but I'm not aware of any significant breaches or violation of patient privacy by this organization.
I think as we ramp up our own billing within the network, because that is sort of a a process that we're, I guess, developing. That is something that, I mean, if 3M is involved, or their platform is involved, it's something that we have to, I think, just be,
Absolutely.
again, whether it be ransomware or some other kind of security issue, it's not something we can take for granted, particularly as it relates to the kind of patient that we're seeing and their dependence on, or I would say probably a patient population that is less apt to be able to protect their own data.
No, absolutely.
And more aware of the need to.
Yeah, and I totally agree. And again, we go through really rigorous processes with, I'm not a computer person. I know enough to be dangerous, but we go through really aggressive processes when we bring on any software like this. It's not the first time I've done it. It's actually one of the hardest processes to go through when you're trying to contract for that exact reason.
Thank you. Just, again, worth monitoring, because you can go through an aggressive process prior to the contract, but on the, the duration of the contract, that plus the United Audit Services.
I totally understand. Yeah, it's not just the initial process, it's continuous security checks.
Thank you.
Yep.
I am curious, though, if there is a 3M representative, whether they could help, discuss what they have seen as challenges and how they've met those challenges for the future.
Sure, I believe Craig is on the line. Craig, did you hear that question? Make sure you're not muted.
I can't see if can you see if he's muted?
Yeah, it's Craig Higgins.
I see him on the list.
Oh, sure.
And while we're waiting, is this for the entire department in terms of coding, or just for general, or for both general?
Yeah, so I manage a team that's over the network. So we deal with coding at both hospitals, Laguna Honda and Zuckerberg, San Francisco General, and we do clinic work as well.
And how is this one different from the United Audit System?
So this is software. UASI is providing supplemental staff that we use while we're hiring after someone's retired, things like that.
So the staff use this software?
Mm-hmm. Yeah, this is not people. This is just software.
And Craig is unmuted. I'm not sure why he's not able to be heard on our end. Is there anyone else from 3M who's there?
No, he's the rep.
There's a hand. Is that hand?
Yeah, I'm not sure what to offer.
Is that something we could take as a follow-up, and I could provide a statement from him for you?
Sure.
Yeah.
Okay. I can,
Yeah.
That would be fine.
Okay, great. Thank you.
And he says,
Hi, this is Diane Promo, and I can see on the monitor that Craig Higgins is trying to speak, but he doesn't seem to be able to. And I can put in chat if there's something you would like him to do.
well, it's a response that's longer, I think, than a chat.
Yeah, Diane, I think we'll
No,
take
I
it.
meant, but if there's a way that you can unmute him.
Yeah, he is unmuted.
He is. There's
Okay.
It's a technical issue. We'll take it as a follow-up, Diane, and provide a statement.
Okay, sounds good, thanks.
I see a hand raised. I'm not sure if this is, I'm going to see if that person is related. Hi, caller, are you related to 3M?
Yes, this is Craig Higgins from 3M.
Oh, great. Okay. You're on the phone. Okay.
Craig, did you hear the question?
I believe so. Maybe just a little more specific. Was it specific around security or just coding security in general?
I think the question was around security issues that the company may have faced in the past with other clients and how those were handled.
I'm not aware of any that we've had. Again, I think you mentioned it very well. That we're a very large company. I think any of those issues would have been brought up, but I'm happy to go back to our legal and technical, see if we've got any documents that get an attestation from that perspective. But as you know, during the RFP process as well as the contracting process, we've gone through very significant attestations as far as security policies, HIPAA requirements, as well as hosting requirements and service level agreements around any notification of those type of things. So we're happy to go back to legal if you need an actual physical document or something to describe that.
Does that help?
Yeah, I mean, it confirms what you were telling us, so that's helpful to hear it from the company itself. But again, throughout the duration of the contract, again, the monitoring, because it could happen at any moment. It could be happening now.
Absolutely. And we
right?
we take that very much into consideration.
Any other questions or comments, commissioners, on this?
Well, yeah, I'm wondering, I hate to put the company to more work looking at documents. It sounds like this has been reviewed through the RFP process. So I think Commissioner Guillermo's admonition is the monitoring that's really important so that we don't become their first case. And so it isn't just the fact that there's software, but how our people use the software.
Sure, and again, I can provide material to bring clarity around that if that would help.
Well, I think, well, to me, your assurance that you have this in mind and you know, are aware of it, alert to it, is, I think, the role that we have, and that we don't, unless Commissioner Guillermo or Commissioner Chung wants more, to me, that's satisfying.
Yeah, I don't think there's necessarily any documentation that's warranted at this point. Yeah.
Thank you.
Yeah, it is indeed a bigger conversation. I think that everybody has like cybersecurities and all these violations in mind, you know, like given that most of us have received emails and said that, you know, all our accounts been compromised 10 million times. Yeah, so that's the main concern, but it wouldn't be just for this service.
Sure.
Do we have a motion to approve this contract?
So moved.
Second.
And if I may check public comment, folks on the line, if you'd like to make comment on item 4, please press *3 now to raise your hand. *3. All right, I don't see any hands, commissioners.
Okay. All in favor, please say aye.
Aye.
Okay, and this will also add to the consent calendar for approval.
Thank you so much.
Thank you. Item 5 is a request for approval of a new contract with Bamboo Health Incorporated. Please feel free to adjust the microphone as needed.
Good afternoon, Commissioners. Requesting to approve the procurement of the Bamboo Health integration. This is actually going to assist in connecting our electronic health record with our CURES system, the DOJ's CURES system. CURES stands for Controlled Substance Utilization Review System, and it's going to provide prescription drug monitoring data to our prescribers and pharmacists at point of care. So it's going to provide for more efficient clinical workflow where they can have access to the data of controlled substance dispensation and prescription, which will aid our prescribers in managing the utilization of controlled substances and also be able to identify any misuse or abuse of controlled substances. Any questions?
One-time purchase of the solution that's required. It says that, or it's a service, right?
It's
the
a
integration
service.
service.
I'm sorry?
The integration service of
Correct.
CURES with
Yes.
our. Okay.
Correct. And then it's going to be based on licenses of prescribers, of how many prescribers are actually going to be utilizing the system.
Is there ongoing cost for maintenance of the?
It's just the licenses, and I have Chris Meehan from from the vendor. Chris, do you want to speak to that, please?
Yeah, Rosanna, it is a ongoing subscription for the service, and it's done annually.
If it's done annually, why do we just have a 15-month contract?
Chris, do you want to answer that? I believe the Department of
so
Justice.
we based the initial procurement off of our contract with the California Department of Justice, CURES, as Rosanna mentioned. So our contract currently expires on June 30th, which we hope to naturally auto-renew, but that was the decision to base the contract around the CURES, the existing CURES agreement.
So just because this is a DOJ mandate that we have to pay for, correct?
Correct. Yes.
Yeah.
And it says our hospital, so it's just for the hospitals, or it also is for our clinic providers?
For clinics, this is actually ambulatory inpatient Laguna Honda
All
long-term
right,
care.
so it's not just the hospitals?
Correct.
As, you know, because the states are hospitals. And this is sole source,
Correct.
Is it because they are the only provider of this service under California, or what?
That is my understanding. Chris, could you confirm that? The DOJ actually awarded it to Bamboo Health.
Yeah, so we are the dispensation vendor to collect this information, and based on the results and everything we talked about, this was the decision to do sole source.
So is there a reason that the health equity review process is by way of the Human Rights Commission rather than our own people?
I don't know the answer to that.
That's a good question.
Can I get back to you on that one, as far as the question is concerned?
Yeah, I think, you know, because this is the first time I've seen that where, you know, an alignment of a contract with the Human Rights Commission. So the question is, are we going to do that for all contracts in the future and have additional supervision of health equity, or what? So maybe Mr. Goodwin knows the answer.
Somewhat, commissioners, this
Hey, you want to get closer to the mic?
Yeah, sorry
Thank
about
you.
that. Sorry to interrupt. The Office of Health Equity is still finalizing the details of this process, which will become part of the information that we collect on these forms. When we updated these forms at the end of the last calendar year, December or so, we put that information on here. And as they have their training and roll this out with the systems of care, there'll be more information on here. And there is a process where it is also collected and shared with the Human Rights Commission. So the language on this might evolve as we learn more from Office of Health Equity.
Yeah, I think you might want to clarify the language that you might be sharing between commissions, but if in fact it's our health equity
It should say to the health
department that actually is doing our monitoring, we can share it with whatever department it is. But this sounds like instead of that, the Human Rights Commission has the oversight, and rather than our department.
I'll get clarity on that.
Yeah,
and we'll
so
update
I don't
this.
think the Human Rights Commission have the health equity part of this. They have the non-discrimination ordinance and the racial equity. And yeah, so it's kind of different. So we just
Sure.
want to make sure that, you know, like we are not confusing the two.
Right, and the Office of
Right,
Health
'cause
Equity
it's-
is within
it's a little
DPH,
confusing
so,
here.
yeah.
Because it does say the racial equity, but yet it's under the health equity section.
Yeah, health equity.
Yeah.
Or creating more bureaucracy.
Or,
Well, this is the city, yes.
It's a big city.
Very big. I'll check into that. I'll check in with colleagues at OHE and clarify the language moving forward.
Okay, thank you. I would move its approval.
I'll second.
And do we have any public comment on this?
Folks on the line, if you'd like to make comment on item 5, please press *3. No hands, commissioners.
Okay, all in favor, please say aye.
Aye.
Okay, we'll put this on the consent calendar.
Thank you very much.
Thank you very much. Item 6 is emerging issues, commissioners. And again, I've just, on your behalf, I've noted many of the things you talked about, and maybe we'll have like a kitchen sink conversation around processes, and I'll check in with you so it can be better defined. But any other issues you'd like to bring up?
Not for finance and finance.
Okay.
I think that really is big as far as we've been talking about before, what to do with discussing the mega contracts. And the report we got is really quite helpful and builds on that. So I do think it's not just health right, but it's, you know, all the mega contracts.
Yes,
Yeah,
sir.
and for context, this is something that we've been talking about
For years.
10 years.
Yeah,
at
we don't
least.
just want to pick on
Yeah.
health right. That's
No, of course,
About
yes.
10 years, yeah.
Yeah, yes. Oh, yeah, and the mega contracts have gotten more mega.
I'm sorry, Commissioner Guillermo? Great. Folks on the line, if you'd like to make comment on item 6, emerging issues, please press star 3. All right, don't see any hand. Yes, so that's not for staff. I see a hand, but that's just for the public. And we're moving on to item 7, public comment. Oh, actually, Wasim, if you would like to go ahead and unmute yourself and speak if you'd like to make comment on the financial stuff.
Oh, yes, actually, I wanted to answer because I believe there was a question in the beginning about HR 360. So I wanted to just see if, you guys want me to just jump in now and talk about it, or
No, it's going
submit
to
it
be it'll be a separate issue. I'll contact everyone and we'll figure that out.
Got it. Thank you.
Sure. All right, item 7 is general public comment. This is for folks from the public to make comment on something that's not on the agenda, a topic that's not been on the agenda. Please raise your hand by pressing star 3. All right, no hands, so we can move on to item 8, consideration for adjournment.
Second?
All in favor, please say aye.
Aye.
Okay, the meeting is now adjourned. Thanks so much.
Thank you very much.
Now I'm going to my